All right, today we're going to tackle a really complex and aggressive form of blood cancer, acute myeloid leukemia, or AML for short. We're going to dive into what it is, how it really hijacks the body, and, importantly, the ways we're starting to fight back. So let's get right into it.
So what you're looking at right here, this is a microscopic snapshot of what's happening inside the body of someone with AML. You see all those big, abnormal-looking purple cells? Those are the cancerous invaders. They've literally taken over the body's factory for making blood cells. It's a complete hostile takeover, right down at the cellular level.
You know, to really wrap your head around AML, it helps to think of your bone marrow as this incredibly sophisticated factory. It's constantly churning out all the essential parts of your blood. But with AML, that factory has gone terribly, terribly wrong.
So, officially what AML is, it's a cancer where the body's trainee blood cells get stuck in a really early stage of development. There's a name for this, it's called maturation arrest. Basically, these immature cells, which we call blasts, just refuse to grow up and get a job. Okay, so here's how that factory is supposed to work. It all starts with a healthy stem cell. That gives rise to what's called a myeloblast. Think of it as a trainee. This trainee is supposed to go through a few stages until it becomes a fully mature worker cell, like a neutrophil that goes out and fights infections. It's a perfect, functioning assembly line. But in AML, that assembly line is completely broken. The myeloblasts, those trainees, they never finish their training. They just get stuck. And what's worse, they start making endless copies of themselves. Before you know it, the entire factory floor is just flooded with these useless, immature blast cells, and there's no room left for the real workers to even be made.
So, you have to ask, what causes this massive factory breakdown? Well, science has been able to unmask a few potential culprits and risk factors.
We do know some things that can definitely raise a person's risk. Certain genetic disorders, for example, or being exposed to chemicals like benzene. Even prior treatments for other cancers can play a role. And the same goes for pre-existing blood disorders like MDS, which can sometimes morph into AML. But, and this is a really crucial point, for most patients, we never find a specific cause. It just seems to strike completely out of the blue.
Now, when the bone marrow factory starts to fail, the body doesn't just stay quiet. It starts sending out some pretty clear warning signs that something inside is seriously wrong.
This whole crowding out situation has three major consequences. First, you get a shortage of red blood cells, which causes anemia. That's why people feel so tired and weak. Then you have a lack of healthy white cells. That's called neutropenia, which means the body can't fight off germs, leading to fevers and infections. And finally, a low platelet count, thrombocytopenia, and that leads to all the easy bruising and bleeding.
And right here, you can actually see how those internal problems show up on the outside. The mix of low platelets and those leukemic cells getting into the gums can cause really bad swelling and bleeding. In some cases, these rogue cells can even break out and invade the skin, creating these rashes or lesions.
So to make the official diagnosis, doctors are looking for a very specific number. The World Health Organization defines AML as having 20% or more of these immature blast cells in either the bone marrow or the blood. That 20% figure, that's the tipping point. That's when the takeover is considered official.
Okay, so diagnosing it is one thing, but fighting it? That's a whole other ballgame. The entire goal of treatment is to completely wipe out those cancerous blasts and let the healthy factory restart production.
The standard game plan is a two-phase attack. First up is induction therapy. This is a really intense initial blitz of chemotherapy designed to get the patient into remission, which means getting those blasts down to less than 5%. If that works, the patient moves on to consolidation therapy. That's more chemo designed to hunt down and destroy any sneaky leukemia cells left behind that might cause a relapse.
But, and this is fascinating, not all AML is treated the same way. Most types get that classic chemo cocktail, but there's this one specific subtype called APL, acute promyelocytic leukemia, and it is a remarkable exception. It's treated with this revolutionary non-chemo approach using a form of vitamin A and, believe it or not, arsenic. This therapy actually forces the cancer cells to mature and then die off. It has totally transformed what was once a super deadly disease into one that's now curable in over 90% of cases. It's a real game changer.
And beyond the standard stuff, the arsenal is getting bigger. We now have targeted drugs for specific genetic mutations, like one called FLT3. For really high-risk cases, a stem cell transplant is often the best shot at a cure. For patients who are older or not as fit, there are gentler, lower-intensity options. And of course, holding all of this together is supportive care. things like transfusions and antibiotics to keep the patient strong enough to keep fighting.
So, with all these treatments, what does the road ahead actually look like for a patient? Well, their prognosis usually comes down to a mix of their age, their overall health, and the very specific genetics of their particular disease. This slide really breaks it down pretty clearly. On the favorable side, you have things like being younger than 60 and having specific genetic markers, like the one for that APL subtype we just talked about. On the other hand, things like being over 60 or having AML that came from a previous blood disorder or having certain high-risk gene mutations, those unfortunately point to a tougher road ahead.
And this chart, well, it shows the stark reality of that age factor. While about 30 to 35% of adults under 60 can be cured with the therapies we have now, the long-term survival for patients over 60 is, unfortunately, less than 10%. It's a really sobering reminder of just how challenging this disease continues to be, especially for older folks.
The fight against AML is clearly shifting. We're moving away from a one-size-fits-all approach to something much more personalized. And that leaves us with the big critical question for the future. As we get better and better at finding and targeting the unique genetic weak spots in each person's leukemia, can we finally develop therapies that turn the tide for every single patient, no matter what their age or risk factors are?